Hey, good morning. This is Dr. McDaniel at GYN Corner. It's Wednesday, July 3rd, almost Independence Day, and I just want to explain I've been trying to do a presentation every day since April, I believe I started. May have been, since early April, end of March, early April. I did not do one yesterday because I was running around all day. Anyone who's been following the presentations knows that I was out of the country and I fell in the tube station gap in London, and I had an evaluation Monday. I was walking around with a broken shoulder. I fractured my shoulder bone. And then yesterday we had a full day of patients. Came in, the trains were running delayed. I came in, started working, and then I had to cancel some patients midday to see a vascular doctor. It turns out I pulled my thigh muscle, my hamstring. There's about a plum-sized blood clot sitting there, hematoma, so my leg was all been swollen all this time. It's been a lot of pain. And then, of course, as soon as I came back from the vascular surgeon, I had patients to see. We saw everyone. It was busy, and then I just left as soon as I finished the train, got home. By the time I sat down to do the presentation, it was 12:30, so I said, forget it. So here I am this morning. So I did not do yesterday's presentation, and that was supposed to be on colposcopy. So I'm going to do that today. As I mentioned, today's Wednesday. Monday, if someone has an abnormal pap smear, then it is evaluated to get a diagnosis by a colposcopy. And the colposcope is just a large magnifying glass. We evaluate how the cervix looks under magnification for tissue changes and blood vessel vascular changes. Once those changes are identified, biopsies are obtained. Biopsies are samples of the cervical skin. The pathology doctors are able to give us a diagnosis based on those biopsies because it's a sample of the entire skin layer of the cervix. They cannot give us a diagnosis from the PAP because the PAP is not the skin layer. It's just exfoliated superficial cervical surface cervical cells, and that gives them an idea or an impression of what's going on, but it doesn't give them the whole picture. Once we have the colposcopy done and we get a diagnosis, sorry, I'm not feeling very well today. We have a diagnosis, then they will give us the report, and the report can come back in a variety of presentations. It can come back potentially with early mild precancer changes. So we call that LGSIL, or low-grade squamous intraepithelial lesion. So everyone's cervix starts out as normal. Due to HPV, or human papilloma viral infection, those normal cells can morph. I always say it's like David Banner turning into the Incredible Hulk. There's that transition time where he looks like David Banner, but he's green and his hair is woolly looking. Those are precancer changes. So the Incredible Hulk is cancer, David Banner is normal. That transition where the lightning is flashing and David is green and kind of crazy looking, those are precancer cells. So the precancer cells we divvy into two halves, either early precancer or late precancer. Technically, there isn't a medium precancer. If someone has early precancer, we call those low-grade changes, or LGSIL. If someone has a diagnosis of LGSIL, they have two options for management. The first option I'll go into today, and then I'll finish it tomorrow. The first option is what I call do something. The second option is what I call do nothing. The first option, or the do something, is what we used to tell everyone they absolutely had to do. There wasn't any question about it up until maybe around 8 years ago or so. And that's a treatment procedure, Treatment procedure is a freezing procedure. It's called cryotherapy or cryoablation. Some people call it cryosurgery. It's a freezing procedure. I have a tank of nitrous oxide, and a probe. I put contact medium on the cervix, I place the probe, and it literally forms an ice ball on the cervix. It freezes that cervical skin, and in freezing the cervical skin, it dies, it exfoliates or sloughs off, and fresh normal cervical tissue is present, rejuvenates. Now, I always tell everyone that freezing procedure is an exfoliation process. It's kind of like people who get the chemical peels for age spots, liver spots, freckles, or wrinkles sometimes. We're just cleaning off, stripping away the outer surface cell layer of the skin. It's the same with the cervix. The cervix has a skin layer. The skin layer is called the squamous epithelium. And that squamous epithelium or skin layer is where precancer changes start and where cervical cancer originates. So when someone has precancer changes and they're early or mild, we can strip away those changes that are present at the time with the freezing procedure, and then fresh normal cervical tissue is what rejuvenates. Now, they've done a bunch of studies. The world's experts have done a gazillion-and-one studies on women who have had this diagnosis, had the freezing procedure done, and then they were monitored over kind of what's considered a danger zone time period, first 2 years after that diagnosis was made. And the studies, and what they did was they did PAP smears every 3 to 4 months for that 2-year time frame. And the studies have shown that if someone has that diagnosis, they get the freezing done, everyone's going to be normal immediately after the freezing because we just cleaned away all the abnormal cell changes. But if you monitor them for that 2-year time frame, at the end of that 2-year time frame, approximately 65%, 80 to 85% of women will still be normal at the end of that 2 years. I'm going to stop right there. I'll go into more detail on this diagnosis, the management, and the treatment tomorrow. Thank you for joining. I apologize for not producing anything yesterday. I'll try to make up for it throughout the week. Thank you for joining. This is Dr. McDaniel at GYN Corner. Please check out the previous presentations on this Facebook page or go to the YouTube channel where I have them nicely organized and delineated. The YouTube channel is still about 2.5 to 3 weeks behind this Facebook page. Thanks a lot. Have a great rest of the day. Bye.